Hi everybody, it's Dr. Vanessa, the People's Nephrologist. This time I want to talk with you about getting on the kidney transplant waiting list. It can seem a bit of a mystery, and I want to give you some tips to take some of that mystery out of it. This is information that I would give my patients either to prepare them for their evaluation appointment so they wouldn't by mistake make themselves look worse as a candidate than they really are, and for the people who weren't quite ready to be referred for evaluation so they could know what was going to be required of them so that they could get their shit together so that I could actually refer them. And all of this matters because there are a lot more people who want kidneys than there are kidneys available. Last year, the U.S. did about a little less than 19,000 kidney transplants, and that's more than we've ever done in a given year. However, there are some 90,000 people waiting for a kidney transplant, and I don't even know how many get rejected. But what I do know is that 13 people die every day waiting for a kidney transplant. So this is why the transplant centers really want to make sure that they're giving kidneys to the best possible candidates who are going to really be able to make the most of this very scarce resource, live their best life, and not to somebody who's basically, pardon the pun, gonna piss it away. Okay. So granted, some of the things aren't so objective and don't make the best sense in my opinion. So this is my insider tips on what they're looking for. Of course, first you have to have insurance that is going to pay for a transplant evaluation and for the surgery. I practiced in a setting where a lot of people were uninsured, and the insurance that the county provided was not going to pay for transplant. And sadly, because that population was also pretty young, they weren't going to be eligible for Medicare until they got to age 65 or they started dialysis. And if you remember from other videos, you can be eligible for the kidney transplant waiting list when your GFR, that kidney number, how well your kidneys are functioning, hits 20. And most people don't need dialysis until that number is below 5. And the time between those two numbers can be years. And how long you're on that waiting list is one of the most important factors in determining when you get a kidney. So sometimes there's not so much, but so much you can do about the insurance aspect. But at the very least, once you start dialysis and you have Medicare, the time is backdated to when you started, no matter how long it takes you to get through the process. So part of the being on the wait list at a GFR of 20 is knowing that you have that number, that's where your kidney function is. So you not only have to be paying attention to what's going on with your health, but you have to be in care, and not just any care. You have to be in the care of a nephrologist, because only a nephrologist can refer someone to be evaluated for kidney transplant. So that's where some of the subjectivity comes in, because nobody is looking over nephrologists' shoulders to make sure that they are referring every potentially eligible person. So pay attention and have somebody with you that can help you pay attention, because yes, all of this can be really overwhelming. The second thing is, of course, you need to be healthy enough to get through a kidney transplant evaluation. Some of this you'll have control over, like if you're way too overweight, and a lot of that is like the belly fat. Unfortunately, most of these transplant centers will go just by body mass index, which is really it's not intended to measure fatness, and it's not greatest measure at all because it takes your height and weight into consideration, which is why some professional athletes can have a really high BMI, suggesting that they're fat when they're not. So I know that this can be a barrier for some people, particularly because if your BMI is too high, they will reject you outright. And what I encourage people is to either have your nephrologist or your primary care doctor speak on your behalf so that you can at least get to talk with a surgeon, because it's basically the surgeon who can really judge if you have too much belly fat. And that matters because fat doesn't heal wounds very well, and so it can set you up for not doing well after a surgery. So that's why that matters. Otherwise, sometimes people will develop a cancer. That's not a definite no-go, but you have to be in remission for at least 5 years. Other things, you definitely can't be smoking or, have a drug or alcohol problem. I know we've seen where exceptions are made for celebrities, but for us regular folks, these are pretty hard lines that are drawn. You have to abstain for at least 6 months. These next couple of things are pretty soft, and this is where I have found people need the most help. One is social support. Some centers require that you have at least 5 people who will vouch that they will support you after a surgery. And I think this one, I understand you do need some support, but I think it turns out to be a bit unfair to people who are fairly alone in the world. And I think this is something that the system could provide for people, help after surgery. But I've seen people get completely disregarded because of it. So, and a lot of times people will say they have no support because they don't want to be a burden to their family members. And what I want to stress to you is that they're not looking for someone that can, change your wound dressings, something really technical and, that you have to be kind of trained for to do. They're talking about support in the sense of somebody that can, help you get to an appointment or to pick up a medication, that kind of thing. So I really encourage you to get the names and numbers of some centers, say 5 people, that will be willing to do just little basic things like that. And the other thing I'll say is that while many patients are worried about being a burden, family and friends, they want to know how they can help you. So drop a little bit of the pride and the guilt and whatever else you're holding on to, and allow people to help you in these little but really meaningful ways. The final thing, the final tip I want to share with you is about adherence. And sometimes we use the word compliance. That particularly pertains to patients who are on dialysis, because there's this record of if you show up, if you stay your whole treatment, if your numbers are looking good, to suggest that you are taking your medications, because that's all transplant is. Once you get past the surgery, it's all about, are you taking your medications as you're supposed to? Because if you don't, you can risk a very big risk of losing the kidney. So they figure future behavior is the best predictor of that is past behavior. So it's really important that you're somebody that is following the advice, the medical advice that you're encouraged to do. And if there's a reason why you're not, really talk to somebody about it. I've been in a situation where there were reasons why the person wasn't coming to dialysis on time, and I would I would advocate on their behalf by calling and speaking with someone at the transplant center to let them know, hey, this is the reason. So don't just discount this person. I do think that they will be a good candidate. All right, so that's all I have. I'll come back soon and try to shed some light on all of these different types of deceased donor kidneys. Like, should you be willing to accept an extended criteria donor? And I'll go into all of that next time. So I hope this much was helpful and that you will like, subscribe, and share with someone else who might find it useful. And as always, feel free to comment, go to my website, thenephrologist.com, check out other things there, and you can reach me through the website as well. And let me know what's on your mind, what questions you have, or if there are any details that weren't clear to you. All right, until then, take good care.